So I will tell you a little bit about myself. I am trained as a neuroscientist. I'm a professor at the University of Montana in the School of Pharmacy. So I teach pathophysiology, anatomy, and physiology. And my research was traditionally looking at CNS injury of the brain and the spinal cord, and recovery from that injury. And I got into Ayurveda, maybe 13 years ago, when I sort of hit a dead end in my research. I wasn't quite sure where to take the next step. And I was doing yoga, and I got Yoga Magazine. You know, we do a lot of magazines like that in the US. And I'm looking at the back, I'm flipping through, and I see an ad for Ayurveda training. And I'm like, Ayurveda training, I wonder what that is. And I looked up Ayurveda, I'd never heard of it before. And what appealed to me as a scientist was the concept of doshas, and how that really is, in a Western sense, a genetic basis for how you think about physiology. And I was looking for new ways to think about physiology. So my School of Pharmacy is very liberal and inclusive, and so I went and got trained in Ayurveda through Kerala Ayurveda in the United States. And when I came back, I started to incorporate sort of Ayurvedic concepts and principles in my research, and I teach a sort of introduction to Ayurveda class to pharmacy students. So what I want to do today is tell you a little bit about my passion, which is neuroinflammation, and how that relates to what we have classically thought about as psychiatric diseases. And then we'll talk about how some of our Ayurvedic therapies, and actually, honestly, everything in Ayurveda is geared, I believe, towards reducing inflammation. But we'll talk about some of the scientific studies that have been done with the Ayurvedic approach. So I tend to talk quickly. I tend to talk very definitively. But I'd really like this to be a conversation. I don't want to just talk for 40 minutes and then have questions. So please ask questions as I go along if something comes up. I have a presentation sort of put together, but I am totally open to going down any pathway you're interested in. Okay? So please don't hesitate. Just raise your hand because it's kind of dark in the back and I can't see too well back there. Okay, so when I started my training in Ayurveda, you have to remember this was like in 2005, 2006. And what I took away from my training was obviously, to us now, the importance of digestion. And that a lot of what Ayurveda was doing was reducing inflammation. And look what's happened in Western medicine since then, right? The whole gut microbiome. Now everybody's thinking about their gut and digestion, but they weren't back then. And inflammation has been shown to play a big role in a lot of diseases, as being underlying for cardiovascular disease, metabolic syndrome, a whole host of diseases. So for me, that was kind of that was the first clue that Ayurveda was really speaking to our modern medicine, and that maybe we needed to modify our approach to modern medicine. And look where we are now. We've got sort of personalized medicine. We think about our gut. We think about inflammation. And so inflammation is one of those concepts that bridges between Ayurveda and allopathic medicine. And as Sebastian was just saying, a lot of our Ayurvedic herbs reduce inflammation. And in fact, most plants can reduce inflammation. And one of the challenges, I think, for studying plants in herbal medicine is that plants have such a wide variety of function, and they have a lot of phytochemicals. And so you can find almost anything you want if you go into a cell culture system or you're looking for some effect of a plant, you can find it. And what's nice about Ayurveda is it tells you clinically, what is our experience? What does this plant do in our clinical experience? And then you can go back and really focus your scientific studies and on proving, or not proving, but understanding how that plant may help with memory, for example. And I'll talk about some of that work at the end. So first I'm going to take you through kind of an overview of our modern concept of inflammation and the role that it plays in psychiatric diseases. Then I'll talk a little bit about some Ayurvedic remedies, and then I'll talk a little bit about my own research with plants like bacopa and turmeric and gotu kola. So we know that so many things in Ayurveda can reduce inflammation, not just our herbs, but meditation, yoga, exercise, panchakarma, all of those reduce inflammation. And so you could say that one of the major aspects to an Ayurvedic therapy, whether it's diet, whether it's lifestyle, whether it's herbal remedies, is the reduction of inflammation. So how can we take that concept and look at it with the lens of Western medicine? And one of the things that really struck me when I was learning Ayurveda was the concept of Majjadhatu. And that is the relating to the bone marrow and nervous tissue, everything that's within bone. But it's a linkage between the immune system and the nervous system. So the main function is communication, but it's everything that fills the bone. So in our bone marrow, we're making immune cells. Our skull and spinal column are protecting our nervous system. So it represents that communication between our central nervous system, which is our brain and spinal cord, and the immune system. And now, today, in science, this seems so obvious because there are a lot of studies that have looked at now and documented this intertwining of the immune system and nervous system. But 13 years ago, we weren't really thinking about it like that. And Ayurveda considers Majjadhatu one functional unit. And that's where we're evolving in the field of neuroscience, is to look, you can't separate out the nervous system and the immune system. And many of the chemical mediators that I'm going to talk about are found both in the nervous system and in the immune system. So more and more our Western medicine, our biomedicine, is turning towards inflammation and that role that it plays in diseases and in the function of the nervous system. So we know that inflammation plays a role in cardiovascular disease, in diabetes, in metabolic syndrome. We also know that it plays a big role in neurodegenerative diseases like Alzheimer's disease, Parkinson's disease. But what's really interesting to me is that it is being shown to play a larger and larger role in diseases like depression, anxiety, schizophrenia, chronic pain, diseases that, from a neuroscience point of view, we thought of as neurotransmitter diseases. We didn't really think inflammation played a big role in those kinds of psychiatric diseases, and I'll show you some evidence now, not with everybody. So this is where sort of the personalized Ayurvedic approach comes in, that inflammation does play a role. Recently, so there's been a whole host of studies that have looked at this recently, and we have a real recent study from 2017 that showed that not all of us respond to stress in the same way in terms of our inflammatory response, which of course makes sense, right, based on our Ayurvedic principles and our individual genetics. But people that have a response to stress that is an increase in inflammation are more vulnerable to chronic diseases. So if you get stressed and your immune system ramps up and you've got a big inflammatory response, you tend to have more of a susceptibility to things like cardiovascular disease and rheumatoid arthritis. Now, the inflammatory response, I don't know if you can see this, but I'm just going to go through this really quickly because I want to focus on these chemical mediators, which we're going to use as markers of inflammation. So what happens is, let's just say you've got a cut and bacteria enter the tissue, you get tissue damage, you release these chemical mediators, and the ones I'm going to focus on are, and I'll give you a brief description of them in a moment, IL-6, TNF-alpha, and C-reactive protein. And like I said, I'm going to just use those as markers of inflammation. When those mediators goes up, that means that you've got an increase in inflammation. And so when those markers get released by damaged cells, they activate the immune response. You get white blood cells that come in and other chemicals that are released, and the bacteria are destroyed and you repair tissue. And so that's basically an overview of an inflammatory response. that's activated by bacteria. So you can get a local inflammatory response, like you get a cut, and then that area gets red as it's healing. That's the inflammatory response. But you can also get a systemic inflammatory response, and that's what happens when you have like chronic stress, and that's circulating, and it doesn't really go down and heal. It's an overactive immune system. So the three chemicals mediators that we're going to talk about are IL-6, TNF-alpha, and CRP. Am I going too fast? I feel like I'm going really fast, okay. So IL-6 is a cytokine, and it has a lot of functions for cells, and you can find it all over the body. It's in the brain as well, and we think it's one of those key communicators between your brain, the central nervous system, and the immune system. And low levels of IL-6 are actually good for you. They're considered to be healing, and they're good for the nervous system. But when you get too much IL-6, it's considered to be pro-inflammatory, meaning it's over-inflammatory, and then it can be very damaging. There was a very interesting study that's been done recently that looked at social threat. So when you get into an environment where you're feeling threatened, not physically threatened, but sort of socially threatened, like bullying or something like that. And they found that IL-6, if you measure the IL-6 that's just circulating in the blood, that goes up with social threat. TNF-alpha we think of as basically a very inflammatory cytokine. It's very pro-inflammatory, and it modulates the nervous system. It's upregulated by our immune system, and we see it increased in a lot of neurodegenerative diseases. We also see it increased in cardiovascular disease and metabolic syndrome, but things like Alzheimer's disease, Parkinson's disease, traumatic brain injury, stroke, we see TNF-alpha. It's one of the classic signs of inflammation. Social threat also increases TNF-alpha. Now, C-reactive protein is a protein that's found in the blood, and it also increases with inflammation. It's produced by the liver, and it's tied into IL-6 levels. So as IL-6 rises, CRP rises. And it helps, it's part of the immune response, and it binds to damaged or foreign cells in the body and helps the immune system get rid of those cells. So we see elevated CRP. I mean, most of you, if you've gone and had a physical, if you've got some kind of inflammatory thing going on, they'll measure CRP, C-reactive protein. It's very commonly measured. You can measure it from the blood. You can also measure it in saliva. But the elevated levels have been correlated with degeneration in the brain, injury to the brain. And interestingly, and we'll get to this when we talk about depression, depressed patients seem to have an elevated CRP level in their blood. So when we talk about the brain, one of the major cells in the brain that releases these inflammatory cytokines and is really considered to be the immune cell of the brain is a small cell called a microglial cell. And we'll talk about them a little bit, but they're specialized immune cells, and they kind of look like these star-shaped cells. They've got a real small cell body with lots of processes, and when they get activated, they get bigger, they release these pro-inflammatory cytokines, and their processes become extended. And what they're doing is they're sort of sampling your brain environment all the time, and they're trying to assess the level of status of your brain tissue. And so if they see that there's a foreign bacteria or a pathogen, then they become activated. So they kind of survey your brain. If there's injury or degeneration in the brain, they move into that area and they help to repair the tissue. So they do two things. So the first thing that happens, let's say there's damage to the brain. The microglia move in, they get activated, they're pro-inflammatory because you want to break down the bad stuff that's in the brain, and then they're called an M1 phenotype. So first thing that happens, you activate the immune system, you want to get rid of the pathogen or degeneration or cells or whatever is there that isn't supposed to be there. Now, once that happens, and the tissue gets cleared of whatever problem it has, those microglia then switch to what we call an M2 phenotype. And then they release chemicals and cytokines that help to repair the tissue. So that's like a normal process. First, the microglia get activated, they become pro-inflammatory, they release TNF-alpha, IL-6, CRP, they get rid of all the bad stuff, then they flip to an M2 to repair the tissue. Problem that we have in terms of chronic inflammation is that those microglia then never flip back to the M2 phenotype. They just stay in the pro-inflammatory phenotype. Now, why do they do that? Well, because the insults to our brain and our nervous system are not just physical. Okay, if it was just physical, they'd flip back. But they're emotional and our response to our environment. So if our environment is stressful, they're going to stay in an M1 phenotype because there's a threat to the nervous system. Now think about how stressful our environment is. It's not very stressful here. It's really nice here. Everybody's sort of relaxed. You're not in a hypervigilant state. But think about what you feel like when you're driving your car. You know, we spend a lot of time driving our car. Well, our autonomic nervous system, our sympathetic nervous system is really ramped up, right? Because you've got to be alert. You've got to be see what's around. If somebody comes in and almost hits you and you can feel that surge of adrenaline, that's a very heightened state. And so when we talk about our environment now, it keeps us in a pro-inflammatory environment. And we actually have to make the effort now to ramp that down. Meditation, yoga, the foods we eat, herbs we take. So instead of our normal state being sort of anti-inflammatory, it's really pro-inflammatory. The other thing microglia can do, and this is going to be relevant when we talk about depression and some of the other psychiatric diseases, is that they can help to remodel the connections between neurons. So neurons talk to each other through synapses, and microglia can modulate that. So they can break those communications if they become very activated. So not only are they producing these inflammatory cytokines, which aren't good for the cells, but they can alter how those neurons are talking to each other. Chronic stress results in loss of these synaptic connections. So when you've got too much stress, you're altering how your neurons are talking to each other. Okay, so stress can really be bad on a number of different levels for the brain. Studies have shown that microglia look activated and they function differently in depressed individuals. They tend to be much more activated. They tend to have a lot of the synapses are surrounded by these microglial processes which can interfere with how the neurons are connecting with each other. So stress activates the microglia, produces those inflammatory cytokines. Psychosocial stress also. So it's not just, as I said, the physical stress, it's a psychosocial stress. And interestingly, women appear to respond to acute stress in a much more pro-inflammatory way than men do. And these are very new studies that are just coming out. And this is associated with mood disorders. So when we talk about women having maybe higher incidence of anxiety, higher incidence of depression, some of that may be linked to a more pro-inflammatory response to day-to-day stress. And I see this with my husband, who's very laid back. He never hardly stresses about anything. And I am just a basket case. I mean, packing to come for this trip, it took me like a month of thinking what I had to take, and I was changing my mind and stressing over it. And like, he packed 2 hours before we got on the plane. So, I mean, that's kind of a joke. But there are some real physical differences in how men and women respond to stress in terms of inflammation. Okay, so that's a little overview of what neuroinflammation is. So, anybody have any questions before I move on? Yeah.
Just about, is it connected somehow to the hormones?
It could be. So the question is, why do women have a more pro-inflammatory cytokine response? Yes, probably. There is, the evidence is, it's not very strong, but it hasn't been very well studied because this data, you can see the paper was from 2018. But yes, it must have some aspect to it that's hormonally involved. Yeah.
Or they're just busier than they have ever been expected to be.
Or they're busier than they are. Well, we're all busier than, everybody is. But yes. Yeah.
So the study was in 1991. Following that, any replicating studies have occurred in science?
In terms of what aspect?
About this.
Oh, I'm going to talk about this in a lot more detail. Yeah. Yeah. Yeah.
With inflammation, and when you're looking at Ayurveda and looking at inflammation,
Mm-hmm.
what do you see do you see there a correlation of any of the Ayurvedic aspects, doshas or ama, or anything that links, you could say, well, that's inflammation? It's not.
Well, so pitta tends to be more inflammatory, pro-inflammatory, but I think ours, and I would argue maybe people that are more kapha have, but our society and our modern life is so stressful. It activates our autonomic nervous system, and we're constantly vigilant. And even being vigilant, just looking on your cell phone, we took the underground out from London to meet our ride. And I looked around the carriage, and like 2/3 of the people were just plugged into their phone. And I thought, oh my gosh, talk about addictions. And there was a mom with her little boy, and she was ignoring her little boy because she was on the phone. And that level of vigilance is also very stressful. But our digital media, it's a random reward system, right? You never know when you're going to get an email, you never know when you're going to get something. And that's a very addictive format. So I sort of danced around your question. I think traditionally you would think that maybe people with a lot of pitta and vata would be more prone towards a pro-inflammatory phenotype. But I don't know in this age. It's really hard to make that, because I've seen some kapha people who are really stressed out.
I suppose, just to explain my question, so pitta is obviously, when you see inflammatory skin or inflammation, but then if you think about rheumatoid arthritis, it's vata and ama, so obviously pitta will be involved in some way, but it's actually the vata and the ama which cause it, which doesn't have the pitta, but no one would doubt that was inflammatory. So,
it is, and I'll talk a little bit about rheumatoid arthritis because the herbs like bacopa that are used for memory and for the mind are also very effective in rheumatoid arthritis models. So we'll talk about that link. Yeah. Okay, so let's go on, and what I'm going to do now is talk. This section is going to be a little bit about inflammation, the role of inflammation in what we think of as psychiatric diseases. And then we'll talk about Ayurveda. So back in 1991, Smith developed this cytokine theory of depression. And what he said was that overproduction of those pro-inflammatory cytokines that we talked about, like TNF-alpha and IL-6, was a cause of depression, and that there was a bidirectional link. So if for some reason you had an increase in the IL-6 and TNF-alpha, you would become depressed. If you were depressed, you would have an increase in the circulating markers. So like most really interesting good science, this was largely ignored for decades. And it only really emerged maybe in the last 10 years or so. And all of a sudden, this became much more of a seminal theory. But when I was training in neuroscience and in the 80s and doing a postdoc, nobody ever talked about this. But now we know that higher levels of these inflammatory cytokines in the blood is really correlated. We don't know that it causes it, although we have some evidence of that, but it's correlated with mood disorders like depression. So people who are depressed tend to have higher levels of those cytokines. And there's some studies looking at the genetics of this, and there are some mutations that some people carry in the IL-6 gene. And those people that carry that mutation tend to be susceptible to depression. Doesn't mean that they're going to get it, but they tend to be susceptible to depression. So we're talking now about a little bit of a genetic basis that's linked to inflammation that leads to something like depression. So it's not just that your life isn't going the way you want it to, and that's why you're depressed. So people also that have inflammatory diseases like obesity, metabolic syndrome, cardiovascular disease, even asthma and arthritis tend to have a higher prevalence of depression. And it's not just because they're depressed about having their disease, it's because they have higher levels of these circulating cytokines. So rheumatoid arthritis. Patients that have rheumatoid arthritis, they have a depression rate between about 10 and 41%. That's a pretty high depression rate compared to the general population, which is about 7%. And it's not just because they're in pain or they're depressed about their disease. So not only do we see an increase in these inflammatory markers in people that are depressed, but the opposite is true. So if you artificially increase levels of those cytokines, you see depression. So how might you do this? Well, some of the treatments, some of our anti-cancer treatments, treatments for hepatitis or leukemia, you treat with some of these cytokines that could be inflammatory therapeutically to help manage the disease. And when you treat them with these cytokines, they have more of a tendency towards depression. And they also, what's really interesting is a brand new study showed that they tend to have an intentional bias towards negative information, meaning they tend to focus on the negative more than they're focusing on the positive. Okay, so this is really emerging as our cancer therapies. We're using a lot of cytokine therapy now to treat cancers. And so we're seeing, for some of those cytokines, increases in rates of depression. Now, the opposite is true if we inhibit the activity of some of these inflammatory cytokines, we see a decrease in the rate of depression. So we have a TNF-alpha inhibitor, meaning it inhibits the activity of TNF-alpha, infliximab. Okay, and that's used therapeutically, and it also reduces anxiety and depression. But the interesting thing, we were getting mixed results with those studies. Sometimes it reduced anxiety and depression, sometimes it didn't. And what it turns out is that patients that had a lot of inflammation before they took their infliximab showed improvement. Patients that didn't have a lot of inflammation before they were taking infliximab didn't show the same effect. So really identifying that inflammatory profile of a patient is really, really important when we're talking about this. Now, drugs like aspirin is a good anti-inflammatory, can reduce both TNF-alpha and IL-6. And so there are some therapies for schizophrenia, I don't know if I have a chance to talk about schizophrenia, that if you add aspirin to the traditional therapy, you get a better outcome. Patients do better. So yeah, this trial showed that 4 weeks of aspirin therapy along with antidepressive medication, you had higher rates of remission with the depression. So patients did better with that. But again, it really depends on the inflammatory profile of the patient. And this is a study where they did a 2-drug combination for depression. And basically, they had a monotherapy and then a bitherapy. And what they showed, meaning 1 drug versus 2 drugs. So they were using bupropion and an SSRI in combination or separately. And what they found was if you had high C-reactive protein levels, they didn't get a good outcome with the SSRI alone. And the SSRI was most effective in patients with low C-reactive protein, so they didn't have inflammation. SSRI alone was good, but if a patient had high C-reactive protein, then you needed to use the combination therapy. So this might explain a little bit about how it's kind of when a physician, from what I understand, puts a patient on antidepressant medication, they kind of have to play around with it, see which one works, see what doesn't, see what combination works. And a lot of antidepressant medication doesn't work better than placebo, but maybe this helps to explain it. So I'm hopeful that maybe in the future, before you start thinking about your medications or what to prescribe for patients, they'll look at C-reactive protein and say, oh, this person has high C-reactive protein, we're going to use both drugs. Or this person has low C-reactive protein, we only need to use one. Yeah.
How would that be measured?
C-reactive protein you can measure from the blood
So what the
or saliva, actually.
there's a test you can buy?
Yeah, it's just a standard tech. Yeah, so I can encourage everybody when we talk about this is like, there aren't very many studies looking at meditation and yoga and sort of inflammatory markers, but you can get a kit to test C-reactive protein and you just spit into it, and so that would be like a really nice study for people to do. Okay, the other thing we know about depressed and anxious patients is that their microglia looks different and that you get much more activated microglia, and in fact, suicide victims have much more activated microglia than a control population. So again, this is very new work that's coming out. So now people are beginning to think, oh, maybe microglial activation is going to contribute to suicide. And oh, I'm blanking now. Some of the antidepressant, anti-anxiety drugs can induce suicidal tendencies in particularly young people. And maybe their inflammatory status or their microglial activation may play a role in that. So it's very well established that we've got this link between inflammation and depression. There's also this really interesting link between inflammation and schizophrenia. So schizophrenia, has a winding course of disease, right? So sometimes people have a psychotic episode and then stabilize, and then they have a psychotic episode again. And what they've shown is that when patients are going through a psychotic episode, they have an increase in IL-6 in their blood. And when they're going down, oh, I have some water, let me just get it. When they're not in a very psychotic state, then their IL-6 is lower. So that's really interesting. And the other interesting thing is a lot of the antipsychotic drugs that are used to treat schizophrenia are also anti-inflammatory. And you know that there are these studies that show, like, if a mom has had the flu, that it increases the risk for schizophrenia. And that has been shown to be because maybe it's the IL-6. So we think about increases in IL-6 as maybe a biomarker for schizophrenia in a certain population. The other thing that has been looked at recently is the receptor for TNF-alpha. So these cytokines have to bind to something to activate a biological response in the cell. And so some recent work has looked at the TNF-alpha receptors and have found that those receptors are upregulated when schizophrenic patients are in an acute stage, in an acute episode. And interestingly, if a patient has high levels of this TNF-alpha receptor, they're not going to respond as well to inpatient care for schizophrenia. It seems to be an indicator that they are not going to have as good an outcome. And again, some anti-inflammatory drugs have been talked about, like aspirin, to be used in combination with sort of the more traditional antipsychotics to help reduce those psychotic episodes. So this isn't really standard of care yet, from the best that I know, but it's really interesting data that's coming out. It always takes about 10 years from sort of the science and the studies to get into clinical practice. But I think as you think about your practice of Ayurveda, you know, taking into account sort of inflammation is going to be very important. And then the last kind of topic that I want to talk about in this section is neuroinflammation and pain and chronic pain. So how many of you have clients or patients that have chronic pain? I mean, probably a lot. And there's a lot of chronic pain in our culture. And chronic pain is often associated with depression. And again, it's not just because you're in pain that you're depressed, and particularly in the elderly. So chronic pain increases the risk of depression by 2 to 4-fold. And depressed patients, alternatively, depressed patients are more likely to suffer from, are 3 times more likely to suffer from non-neuropathic pain and 6 times more likely to suffer from neuropathic pain. And again, we think maybe this link between chronic pain and depression is the neuroinflammation. And for example, as we get older, as our brain ages, our microglia have less of a threshold for responding to an inflammatory response. So they tend to be more pro-inflammatory. Okay, I am not going to talk about this too much because I am going behind. But one thing I did want to mention, because this is really interesting, you hardly see anything about this in the literature. It was one paper that came out, but it's really interesting because it links opioid abuse with inflammation. So opioids can induce inflammation in the body. They've been shown to do that. But not everybody shows a big increase in inflammation when they take opioids. But those people that show a big increase in inflammation are the ones that tend to become addicted to the opioids. So that's something that I think we need to keep in mind and to look out in the future in terms of how this story develops. So it may be that giving opioids when they're necessary, which is a whole other issue, in combination with anti-inflammatories might reduce the risk of addiction. So that, I think that's really very interesting. Okay, so I'm going to spend maybe, whip through this really fast because I'm behind already. Some of the things that we know in Ayurveda scientifically that have been shown to reduce inflammation. And one of those is sesame oil and sesamin, which is in sesame oil. So we all know sesame oil and what it's used for. We use it a lot. And there are recent studies that show that just massaging with sesame oil alone can help reduce pain. So this recent study, they massaged with 10 drops of sesame oil for 5 minutes and reduced pain from chemotherapy-induced phlebitis. So sesame oil is great. It can also reduce IL-6 in some models of Parkinson's disease. So it has a lot of anti-inflammatory responses. Yoga, there are a lot of studies that have shown that yoga reduces inflammation. So there was a very recent review of systematic review of a lot of yoga studies, and what they found was that it can down-regulate those inflammatory markers, and they see decreases in things like TNF-alpha, IL-6, IL-1 beta, which is another big inflammatory marker. And the more that you practice yoga, the more of a decrease you get in those inflammatory markers. Meditation, mindfulness meditation, has also been shown to reduce circulating levels of IL-6 compared to just relaxation. So it's not just that your body's calm and you're not stressed out, but meditation specifically seems to lower those levels of TNF-alpha, of CRP, and IL-6. So that's something that you can tell your patients that one of the benefits is you're going to reduce inflammation and inflammatory processes all over your body. Shirodhara and Abhyanga, which are such staples of Ayurveda, there is like almost no scientific studies. There's almost nothing in the literature on their role in inflammation. There's one study that suggests that sesame oil used for Shirodhara helps to reduce some immune inflammation, but it's not looking at some of the markers that we typically look at now. And there's absolutely nothing showing Abhyanga and inflammatory cytokines. There's one study that shows that Abhyanga reduces heart rate, which is indicative of lowered stress, but there's nothing that really shows that. So would it be a great study to do Abhyanga and take a CRP level of your patient? So those studies need to be done. And then spices, Sebastian talked a little bit about this, but we know that most spices, most plants have anti-inflammatory properties. It would be rare to have a plant that didn't show some kind of an anti-inflammatory, but all of the spices that are typically used in the Indian diet are anti-inflammatory. And interestingly, people in Southeast Asia have the lowest rates of Alzheimer's disease, particularly in rural India. So their rate is 3.7% compared to us, and North Americans are 6.4%. So, curcumin, Sebastian talked about curcumin, and I'm going to talk just a little bit about it because what you have to think about with our spices is that we're digesting them. And our gut microbiome is taking that spice and breaking it down, and some of my colleagues at the University of Montana have taken curcumin, put them into a culture of gut microbiome, and come up with novel new compounds. So when Sebastian said curcumin is not necessarily maybe the best thing to look at, he's probably right, because we have to digest it. And one of those compounds is something called dimethylcurcumin and bis-dimethylcurcumin. And those are metabolized by our gut microbiome. And many years ago, about 5 years ago now, my lab and my husband's lab were looking at bis-dimethylcurcumin because a group in India, Layla, had identified this compound. They made this compound and identified it as being very anti-inflammatory. And so we've done several studies with that. What I do in my lab is I grow those microglial cells in culture, those inflammatory cells, then I activate them so they release all the inflammatory cytokines, and then I put in this bis-dimethylcurcumin. And what happens when I do that is you can see the levels of both TNF-alpha and IL-6 just go way down. So that was really interesting because the people in India, Layla, had modeled that this compound might be produced from the curcumin. And then this paper, where was that? It just came out in 2017 that showed, oh yeah, give turmeric to the gut and this is what it produces. We've also looked at these, this bis-dimethylcurcumin in an Alzheimer's model, and we see a decrease in the plaques, we see a decrease in the microglial activation. It's very interesting. Bacopa, I've also looked at how Bacopa can reduce microglial activation. And interestingly, what I do is I take the Bacopa and I make it into different fractions. But I have whole water fractions, like a tea and an infusion, and we also have an alkaloid fraction. And the alkaloid fraction and the infusion, which is like a tea, reduces the release of these TNF-alpha and IL-6. What's really interesting here is that everybody thinks the active component of Bacopa are the bacchosides and bacchoside A in particular. When I just look at the bacchoside A, it actually increases the inflammation at high doses. So you can't, as Sebastian said, you can't break the plants down into too much of an individual component. We've also started studies looking at Centella asiatica goldicola, and we see the same thing with the infusion, with the water extract, which is how you would take it, right? You take it as a tea or take it as a powder, and you also see a decrease in the release of TNF-alpha. Yeah.
So if you're taking it as a tincture, is it not going to be as effective?
It could be. I haven't tested a tincture. You know, with the Bacopa, I did a Brahmi Grita because traditionally that's how it's used, and it wasn't very effective in my cultures. But that doesn't mean that it isn't in the person. And what's kind of nice about this is you could take Bacopa or curcumin and do anything with it in terms of in vitro and get results. I mean, they're antioxidants, they're everything under the sun. But if you follow the Ayurvedic therapeutic guidelines for what those plants should do, so they should reduce inflammation. Bacopa has been shown to reduce inflammation in arthritis models. It's used for things like hoarseness and arthritis. You know, it's clinically used traditionally to reduce inflammatory type diseases. And then you take the science and say, okay, does it really reduce inflammation? And then you get confirmation that way. So, in conclusion, I think neuroinflammation more and more is going to become part of our modern Western medicine. And I think Ayurveda is really uniquely positioned to offer non-drug therapies to help reduce inflammation, which is not to say that Western medicine isn't helpful, but I think we're going to need to use a combination of diet, lifestyle, yoga, herbs, you know. In America, everybody just wants to take a pill and get better. But these studies are important because they show that the whole spectrum of how you live your life is really important to determine your status, your inflammatory status. Yeah?
You talk obviously of depression, schizophrenia, chronic pain. Are you seeing any emerging evidence linking things like wider psychiatric considerations like ADHD, sensory processing, autism, that kind of thing?
Yeah, I haven't really, but I haven't looked for it in terms of ADHD. I would probably imagine it might. I know that, I didn't talk about anxiety, but anxiety is often linked with depression, and neuroinflammation does play a role in anxiety. You know, it's kind of interesting because I've been teaching at the university for 24 years, and I have seen changes in the last maybe 4 or 5 years in our students as sort of the you know, social media and the digital technology has come about, and they grew up with it. And so I really wonder what their inflammatory status is. I haven't seen any studies that have looked at, you know, kids developmentally, you know, your connections to neurons are sort of laid down and refined between, you know, conception and 10 years of age. And your brain doesn't fully develop till your early 20s. Your forebrain doesn't, which is why teenagers are so stupid and make stupid decisions. But we don't know how our modern lifestyle is affecting it. So it would not, I mean, I haven't looked at the literature specifically on ADHD, but it wouldn't surprise me. Yeah.
Sorry, because you are from USA, I'm tempted to ask this question. Are there any imaging studies comparing the pre-treatment and post-treatment changes in the brain?
Yes, there are some that have, like that, I took it out, maybe I've got it here. I don't have it. There was a study that looked at inflammation in stressed out workers. So they lost their job for a while and they showed an increase in inflammatory markers. And they did brain imaging studies on those people compared to controls. And there were some very subtle changes in areas of the brain that, like hippocampal areas and areas that dealt with sort of amygdala. And so they could find some structural changes. Yeah. Yeah.
Yeah, so how do you make a determination when you're reading the IL-6 of where the inflammatory profile is, that it's a neuroinflammation versus somewhere else in the body?
Well, okay, that's a really good question. Where do you make that determination? So there's some studies that actually are measuring the IL-6 out of the cerebral spinal fluid. And so we make the assumption that that's coming from the central nervous system. But most of the studies are just looking at circulating cytokines, circulating IL-6, which can get transported into the brain. But there are some studies, I mean, in animal studies, they'll actually take the tissue, the brain tissue, and then do that. We obviously don't do that in people, but we can do cerebral spinal measurements. That's a good question. Yeah.
I have two quick questions. There's quite a lot of talk about ashwagandha
Mhm.
neuroinflammation.
Mhm.
Just wondered if you had any
I haven't done ashwagandha yet. It's on my list. I have the herbs sitting in my lab. You know, ashwagandha is interesting because mostly, at least from my reading of the scientific literature, it's been mostly looked at as an anti-cancer molecule. I did a sabbatical with a woman that was looking at its anti-cancer properties. So ashwagandha is very well studied and looking at everything from antioxidant, anti-cancer, and I haven't looked at it yet in sort of a microglial model.
One more quick question. Any
Yeah.
good studies on the role of diet in causing and treating inflammation?
Right, so the role of diets. Okay, so that's super interesting. So how do you figure out a diet, what might cause, like I'm slightly allergic to milk. Okay, so a lot of milk's gonna cause a lot of inflammation for me. But my husband, when he gets an upset stomach, he drinks milk, it's great, it's soothing. He drinks a lot of milk, it's great for him. So diet absolutely is critical to your inflammatory status, I believe. How you're going to study that, I don't know, because everybody is genetically different. It would be really interesting to maybe do it from an Ayurvedic perspective by dosha to see if there's a correlation. Those studies are really hard to do, and even genetically we have a hard time finding genes that are associated with Vata, Pitta, Kapha. And part of that is because we don't have a good standardized dosha analysis that we can use for these types of studies. And so that's why for some people, who was talking about that? Dr. Ram was saying, for some people a particular diet is really good, and for another it's not. So I'll tell you a story. So I go to sort of an integrated medicine physician, and she was like gung-ho on the Whole30 diet. And I'm like, this doesn't really seem like the right thing. But I tend to have a lot of inflammation, and my CRP was a little high. So she's like, just do it for 30 days, and just to pacify me. I'm like, oh. So I did this thing, and I have never been more sick in my entire life. She's like, oh, you'll feel bad for a couple of weeks, and then you'll feel great. And I just got sicker and sicker and sicker, and I just felt awful. My CRP did go down, but I was like crawling around. I felt so bad. So, and I didn't stay on it.
Which diet?
The Whole30, have you heard of that? Oh my gosh, it's so big in the United States, okay? It's a crazy diet. So you cut out legumes and dairy and sugar and wheat. You cut out almost everything. And I love food. And the interesting thing was it had this psychological effect on me because I stopped being interested in eating, which for me is what has happened to me because I love food. So, but for my physician, who's very Vata, she felt great on it, and she stayed on it, and she's telling everybody it's the best thing and that they should do it. And I was really sick. My skin started peeling off. I had all this weird physiological stuff because there was some nutrient I must need that wasn't in that diet. So I think, for those fad diets, that's why some people feel good and some people don't. And I think the most important thing, this is what I tell my students, is pay attention to how you feel after you eat. Either right away or a day after. And then try and play around with those foods that don't make you feel good. Because everybody's genetically different. There's this new field that's emerging called nutrigenomics. And they're talking everybody metabolizes choline a little bit differently. And so people are now talking about that. Well, what's nutrigenomics? That's Ayurveda. Just we don't know the genes, but. So I think diet is really, eating a balanced, well-rounded diet is really important. And what Dr. Ram was saying, I live in Montana. I could never be a complete vegetarian in Montana. Our winters are, well below zero, which I don't even know what that is Celsius, with wind and cold. And we get 3 months of the year where it's above 100. So we have these real swings. And so, your diet is who you are genetically and where you're living. So, I mean, that's just my thing about, about diet. Yeah.
Have you looked at the effects of fasting on these biomarkers?
No, I haven't. I was teaching a neuroscience grad course, and one of my graduate students was like, oh, intermittent fasting, you have to watch this TED Talk on it. I haven't. Now, I can just speak for myself. You know, I don't eat from dinner to breakfast, so I have about 12 hours where I'm not eating. And that works well for me. I'm Jewish, and when we have to fast for Yom Kippur, I can't do it. So for some people, fasting is something that's really beneficial. For other people, it isn't. And I think that's what Dr. Ram was saying, was that you have to find that balance for your own physiology. I don't know of any studies yet, because intermittent fasting and all that has just become sort of popular. We know in animal studies that fasting tends to prolong a healthy aging. So in mice, when they do a fasting with mice, they seem to be healthier. But maybe that's because the mice chow they eat in the lab is not that great for them. You know, I don't know. There's so many variables.
This last year's Nobel Prize was awarded to two Japanese scientists who did research on the effect of fasting on the body and the metabolism.
Right. Yeah. Yes. I think it's an interesting concept. I think we eat too much. I don't think we need to eat all the time. But I think that everybody is really different. And that, you know, our problem in our culture, as both Sebastian and Ram was saying, is that we have such an abundance of food. And we are hardwired for survival to eat as much as possible. And to eat things like sugar and carbohydrates and things that were kind of hard to find in our environment. And so we're constantly fighting our biology with an abundance of food, because physiologically it was like eat while you can, because you're going to go through a long period where you're not going to have that nutrition.
And that is why on the 11th day of each moon cycle in India, most of the people fast. It's called Ekadashi. But that's when every fortnight.
Yeah, yeah. Okay, well, I think we have to end. Speaking of fasting, I think it's lunchtime, so we don't want to miss that.